I want to say it is my honor to welcome our esteemed speaker today, Sara uh, Tompkison, who is a licensed clinical social worker. She is retired as a social worker with the Department of Veterans Affairs, and she currently works part-time as the Geriatric Workforce Enhancement Program social work instructor with the John A. Burns School of Medicine, Department of Geriatric Medicine. She also teaches Tai Chi classes for persons living with dementia and is a certified TPSNO positive approach to care dementia educator. So without any further ado, I'd like to turn it over to Sara. Thank you so much, Sara.
Thank you for those kind words, Dorothy. It's always a pleasure to be able to do something jointly with you. And this webinar comes at a very important time because for those of you who don't know, November is National Family Caregivers Month. And having been a family caregiver and still a secondary caregiver for my father, this is not just professional. This is very personal for me. Um, Before I get started, I want to make sure that I also acknowledge Hale Kūʻike for sponsoring this webinar and the School of Medicine. So briefly, this webinar is meant for you. I hope that with these objectives, we will have an opportunity to interact, to also engage you with giving me and other participants feedback on how you perceive your wellness, your well-being, and mental health. So briefly, the objectives include describing the mental and physical health risks associated with potential caregiver burden. Then for you to be able to explain the difference between internal and external caregiver burden or stress. And then we'll spend the last 15 minutes looking at least two approaches to improve caregiver health, as well as to support your emotional well-being and promote self-care. So we'll do a couple of activities um, at the end. So I wanted to share with you briefly some interesting statistics here in Hawaii, and that is this is from last year, the 2024 data on Hawaii's family caregivers for people that are living with dementia. And I really think we need to have other data for family caregivers in general, but this is all that we have right now. And that is that the number of people that are 65 and older here in Hawaii, that's 31,200 people. And the percentage of adults living with Alzheimer's over the age of 65 is 11.3%. So how does this translate into caregiving costs? The number of family caregivers last year was 60,000. I'm sure it's a lot more. This does not include family caregivers under the age of 18. And I really do feel, especially in our state, just given our culture and respect for our kupuna, our elders, a lot of younger people have put their life on hold to help care for their parents that might have a disability or even their grandparents. This also translates into unpaid care. That's 91 million hours of unpaid care that you are providing as a caregiver. And the value of that care is close to $2 billion. So we really, in the state of Hawaii, need to appreciate, acknowledge, I would say more than that, acknowledge and look at future legislation that would actually benefit our family caregivers. That could look in the form of tax credits. It could take the form of more paid respite. AARP is a great resource to look into as far as their very strong, they have a strong advocacy group and they lobby every legislature. There's also the issue of caregiver health and well-being. The average caregivers with chronic health conditions was 49.6%, close to 50% of caregivers have a chronic health condition. And what we mean by that is they might have diabetes, hypertension, heart disease. And additionally, they found that caregivers are more depressed with at least 16.5%, and they're just in poor physical health. And the reason for that is, I'm probably preaching to the choir here. Caregivers don't really put themselves first. You're all so busy carrying around the clock. You don't eat well. A lot of times you're not sleeping well because you can't sleep if you have to get up in the middle of the night to take someone to the bathroom. You put your health on the back burner. Sadly, a lot of our caregivers don't go to see the doctor on a regular basis. I've had times where I canceled my medical appointments because it was a pressing matter with my mom. There's also dental care or other appointments that you have. So keep that in the back of your mind. Now, how does this impact our workforce locally? Do you know that the number of geriatricians in Hawaii is only 63? And more geriatricians too will be retiring. We need to meet the demand in 2050 of 1.6%. Additionally, the number of home health and personal care aides in 2020 was only 9,290. And the number of home health personal care aides that we need for us to meet the demand in the next 5 years is 32%. I found it was very interesting that the number of emergency room visits per 1,000 people living with dementia is approximately 1,248. Hospice residents or patients with a primary diagnosis of dementia is 16%, and dementia patient hospital readmission rates since 2018 were 16%. So I'm sure when I think about patients that are readmitted to the hospital through the ED, it's higher than 16%. The care costs, Medicaid costs of caring for people with dementia in 2020 was $240 million. And the projected Medicaid costs that exceeds 18.7% from, I cannot begin to fathom from 2026 to 2030, how much that's going to also increase. But it's important to mention, again, what some of those differences are between people that are caregivers, caring for someone that's living with dementia versus a caregiver taking care of someone that does not have dementia. And in this brief slide, you can see that I've listed the medical conditions in the first column. And in the second, it talks about the dementia caregivers, the percentage of those that report having a medical condition. The bottom line is dementia caregivers probably are at the greater risk. It's not to say that caregivers of people not living with dementia don't have chronic illnesses, but it's just a higher risk for those family caregivers of people living with dementia. In this presentation, I should have prefaced myself by saying that I'm going to speak primarily about unpaid caregivers. So there's a difference between paid caregivers. Those are people that work in the hospital or maybe private duty nursing agencies, people that are actually being paid to caregive. But I'm here today to speak about the unpaid caregivers, which are mostly a lot of family members that are not paid. So in honor and celebration of you, I wanted to share this little video. So that's just, I love that little video that reminds us how important you are as family caregivers. So you probably want to know, what is the difference between internal versus caregiver burden? So we talk about internal caregiver burden. It refers to your personal feelings and your state of mind toward your caregiver role. Examples of that can include feelings of inadequacy. More specifically, are there times that you feel you're just not doing enough or that you could do more? The feelings of guilt or shame that come along sometimes because of our own expectations, myself included. There's also the risk of losing your own personal identity because you start letting go of the things that bring you joy and interest you. And you can then deal with loneliness or depression. Some caregivers can sometimes also feel socially isolated, that nobody really understands what you're going through. Because oftentimes, if you don't have a support system, or respite, you're doing this alone. I like to make note that, especially in Hawaii culture, we also influence how one looks at caregiver burden. Some cultures may perceive the objective tasks like bathing, other personal care, medication management as rewarding. And then there's those cultures that may perceive that differently. But again, in our culture, our Asian culture, our Pacific Islander culture, we really have this idea of filial piety, respect, and honoring of our elders. And then I wanted to also note that a caregiver's age, gender, pre-existing health conditions, and perceived social support can also impact how you see your caregiver burden. So understanding external burden refers to the strain that's caused by circumstances or situations outside your control. That includes, but it's not limited to, lack of help from others, lack of community resources, or even problems, the biggest one with finances. I just want to take a minute to reflect on the lack of help from others. What I learned for myself is oftentimes it was my lack of wanting to ask for help. It's very difficult. It was very difficult. I've learned, not just for myself, but for other caregivers, to ask for help. And I think it goes back to feeling like there was times I thought I was the only person that could do the job. And I discovered once I asked for help from my brothers and my sisters, they often did a better job at certain tasks that I couldn't do. So keep that in the back of your mind. It may not also be the lack of help from other people. It may be that within yourself, what's holding you back from asking other people to help you. Problems with finances are very real, because what we see is a lot of people are usually at mid-career. They may be having to take a lower position. Some people are having to work less hours, and so that impacts their finances. And there's people too that have actually had to retire from their jobs in order to care for their parents, or the loved one that needs that help. Other life disruptions can include the increased amount of time the caregiver takes from out of his or her own life to care for the care recipient. I recall that with my situation, when we were caregiving for my mother-in-law, my husband was not able to attend our son's college graduation. Thank goodness we had, they have Zoom, and they have a lot of they could televise the whole graduation, but it just wasn't the same not to have um, my son felt, I guess he understood, but it was different not to have his father there for one of those important life events. So that there's other situations you probably can think of where you've had to take out time from your own life, and hopefully, you do get to attend that wedding for your daughter, or you can take a vacation to Japan, whatever it may be. And then lastly, it's also, when I talk about finances, it may be the amount of money that you have to spend on caregiving. The lack of time or lack of money produces real external burden. So what are some of the caregiver burden risk factors? Well, as you might have guessed, most caregivers are female, although we're seeing more men that are caregivers as well. There's limited education, living with the patient, and the higher number of caregiving hours that are the caregivers tasked with. There's also the physical stress. So that's interesting, because it wasn't the cognitive abilities that were being lost, but it was more the demands of the physical care. So for caregivers, that meant if they had to start doing more of the personal care, bathing their loved one, transferring, helping with other mobility as opposed to maybe medication management, because a person couldn't remember to take their pills. Another risk factor is being unemployed or having a lower income and not having a choice when you have to give up your job, quit your job. Um, that's going to impact your family's income for sure. And then having a strong sense of obligation to be the primary caregiver, that was another risk factor. So maybe that's something to think about. And lastly, family conflict, the cause or effect. So what I mean by that, you know, families are really can be a blessing and a challenge. And the most important thing is trying to work that through. If you can't do that together, then look at mediation. There is a Pacific Mediation Center and other resources to help you look at that, to decrease your external burden. Other risk factors, depression, that was very prevalent in a lot of the family caregivers. There was 30 to 83% of people. Suicidality was found in 30% of family caregivers. And along with depression, there's often anxiety that's overlaps. So it's no surprise that the prevalence of anxiety was 21 to 46% in family caregivers. And along the line of anxiety and depression, there's oftentimes anger, denial about the person who's been diagnosed with Alzheimer's or other dementias, or even other illnesses. Because again, I'm not just speaking to dementia, I'm speaking to the loss that you feel when the loved one that you're caring for, their personality begins to change, or the person with their personality, their mood is affected, and it's not the same person that you remember. And so that is a big loss. And learning how to anticipate and grieve for it is different for each person. There's also the risk for social withdrawal. I mentioned is that isolation. A lot of caregivers will stop attending special events with their friends or families. They pull back on the activities that they enjoy. I mentioned earlier there's a loss of sleep, but there's also the risk of loss of weight. And there's also, at the other end of that, gaining weight and difficulty with concentration. So I wanted to share this, how well do I take care of myself checklist. And I'm just going to show you on the screen. It should take you a few minutes. It's 12 questions. And then we're going to ask you, as you go quickly through these 12 statements, to just kind of circle or write down, if you have a piece of paper, a pencil or pen. I'll give you a couple of minutes, maybe 3 minutes to do this, and then tally up your score. And on the slide, you can see on the on the right-hand side of the slide, you can see what the score means. And then we're going to do some, we'll talk a little bit about, we're going to take your score and then apply that to something practical. Okay? So I'll give you another minute. I think the slides will also be available to you if you've registered for this webinar, and
Yes,
you'll be able to.
they'll be available, and I've dropped them into this is Dorothy. I've dropped them into the chat so they can be downloaded right away. And I've also dropped into the chat some of the resources that Sarah's talked about, the Kupuna Pono Family Mediation, and also about the Grieving Let's Talk Story group coming up on the 20th.
Which is tomorrow. I'm sorry, I just got that flyer last night, but that should be really a good webinar to attend. All right, so we're going to move on. So I want you to look at your checklist for a minute and to just think to yourself and make a little note. What did you learn about yourself when you completed this checklist? It's really not selfish to take time out each day to take care of yourself. And then, what is one thing you want to try doing to improve your physical and emotional well being? And then, when do you think you would start this one activity to improve your mental health wellness? So, next steps, this is asking each of us on the webinar to try to commit to making a plan of action. Okay. So jot down to yourself, to decrease my caregiver stress or burden, I will blank once a day. Maybe it will be, I will meditate for 10 minutes once a day. I will take a nap once a day. I will have lunch with my girlfriends. Maybe not once a day, maybe once a month. But do something that you think of something you could do once a day. And then I want you to identify one thing that's positive about you and put that there. I want to see a positive affirmation that I know, put it down there. You're a good listener. You are patient. You are kind. You care. And the last two things are to improve my physical and emotional health. I can ask for help from, and fill in the blank. And one short-term goal to take better care of myself is to do this thing in 30 days. And I'd like for you all to come back to what you've written 30 days from today and see, wow, did you accomplish those 4 things that you've listed? And if not, it's okay. You don't have to be perfect. Maybe there's one thing that you could do on that list. But then tell yourself, maybe there's a second thing I can try to work on the next month. So we're going to now look at practical approaches to improve caregiver mental health and well-being. I love this photo because did you know until last year, I never held a butterfly. And I was really kind of anxious about it. I didn't want to hurt the butterfly. But at Hale Kūʻike, one of the memory care homes in Nuuanu, they actually raise monarch butterflies and they do releases of the butterflies, and the residents actually give names to all the butterflies. And so when I was visiting, they asked me, do you want to hold the butterfly? And I said, okay. So that was a first. So before we do that, Thanksgiving's next week. The other part of taking care of yourself, as you might get to know about me, is being able to laugh and find each day something that you can learn that's new, but also be able to laugh once a day. So we're going to do some Qigong exercises. Qigong is a Chinese form of deep breathing exercise. It works hand in hand usually with Tai Chi. But for the sake of time, we're just going to, so I'm going to just move. So I want you to find a place where if you're not already sitting, try to sit in a chair with your feet touching the floor and your legs uncrossed. And when we start to stretch or raise our hands, I'm going to pretty much cue you what to do and try to be aware of what's going on with your body. We'll do this a few times. So it's a Qi gathering energy from within what we call the dantian, which is right below the belly button, 2 inches in. Recognize when your body feels tense or knotted. We're going to try these gentle movements. And when you breathe out, imagine that as you're breathing to release the knots or the stress, that you're breathing not from your throat, but you're going to exhale out all the way down to your belly. I guess Western people would say that is diaphragmatic breathing. So you inhale slowly and you will exhale out. You can try this at home. And if you do this even a few times in the morning, or if you're feeling really overwhelmed, it's really helpful just to listen to your body, give yourself a timeout, and then do some of these stretches that we're going to do. Okay. So first of all, as you're sitting there in the chair, I want you to place your hands to the side of your body and raise your hands up to gather that energy up to the forehead. Breathe out slowly, slowly. Again, raise your hands to the heavens and gently release to the earth. And the next breath, give thanks for one thing that you're grateful for today. And release on the exhale. Please enter your comments in the chat or questions about that Qigong breathing. The next thing we're going to do is we're just going to do a back stretch for the morning. So your hands are right below your belly button, dantian. You're going to lift your right hand, I'm mirroring you, right hand up to the heavens and the other pressing to the earth. And feel all the ligaments in your spine stretch. Bring that top hand down, back to the belly, switch hands and raise up and stretch. Opening up that back muscle. One more time to your right and left. Breathe in, breathe out. Breathe in and breathe out. Take both hands in the front, relax. Shoulder rolls up to the ears, roll back, squeezing the shoulder blades. 2 more times. Breathe in, breathe out. One last time. Shoulder rolls forward 3 times. Slowly raise your shoulders to your ears and rotate the joint forward. Breathe in, breathe out. One last time. Breathe in, breathe out. Very good. So stretching to limber your joints and to clear our minds. We were doing some of that. That shoulder roll, front and back, is a good way to relax the shoulders. We did some of the back stretches. I want to show you one last Qigong stretch with the neck. So you place your hands in front of you as you're sitting. Then you open the palms up, open the chest, turn your head to your right shoulder. Turn your head to look at me. Bring both palms to the center in front of your dantian. Breathe in. Open the palms, breathe out. Breathe in as you turn to look at the left shoulder. Look to Sara at the front. One last set as you breathe in. Gently breathe out. Turning your head to the right shoulder. Turn your head to the front. Breathe in. And breathe out. Open the palms. Turn your head. Breathe in. And breathe out. Slow, deep breathing really does help calm our nervous system. And did you know it also can clear your mind? And once you have a clear mind, you can think better. Daily stretching and breathing for just 10 to 15 minutes. If you can't do 20, it's fine. 10 to 15 minutes each day can help create a sense of serenity, peace. It can support strengthening your immune system. It can lower blood pressure. There's so many things that you can do with Qigong. I wanted to leave you with some thoughts about how to experience joy and meaning. Um, I think take a look and maybe lower your expectations of um, of yourself. You work hard all year long, and that's all year, 365 days. And you really don't need to prove anything to yourself. This comes from my own experience as well. Learn to practice an attitude of gratitude. Focus on the one thing that you appreciate in your life as we begin to celebrate the holiday season. And know that you can create your own private holiday rituals just for you. For you are special and you are valued. And I'm letting you know that if no one has told you, you are valued and you are important, not just to the person that you care for, but for so much you do that helps our community. And look to consider simplifying the amount of holiday activities. You get to define how you want to enjoy your quality time with family and friends. Nobody dictates that to you because you know yourself the best. And start new traditions for your family and yourself instead of dwelling on what you or your loved ones are not able to do this year. And lastly, my gift to you is please remember that you can ask for help, even if you don't normally do so. The holidays are a great time to get some extra help. Even just a few hours can be a huge relief. Believe it or not, family, friends, informal groups of people, churches, your clubs, they want to help with holiday preparations. They want maybe watch your mom or dad. It's really no shame because we have a culture of ohana. And so what better way than to feel that you can ask not just your biological family, but your friends. That are some of the researches that is in the slides that she's forwarded to you. I don't know if I put AARP here. AARP source, but I don't remember yet. I really encourage you to do it. I was reading their magazine. They had reported 65 million caregivers across the United States this year alone. There's the Alzheimer's Association has support Kapun information. It's the Elderly Affairs Division, their senior helpline. They call their new the Kapun information handbook. I purposely because you can get the book on the website, download the application to your iPhone so you have quick access. This handbook is everything to nuts. You're looking for transportation, counseling, et cetera, et cetera. I think is another source as well. Go on to their website. I'm sorry I didn't put in their website. I think I've forgotten the foundation, White Friends Association, the support line and their support group. Lastly, remind everyone our couple on the 2nd, we will be thinking about addressing dining with dementia, speaking to joy to the table. And then we'll be doing a webinar on help for dementia care partners. So we hope you can join us and just consider registration. Once you're registered, at least you can access the Zoom webinar for you. Thank you everyone for your time and for your patience. And we're going to put it up for questions.